And for more, let's bring in infectious disease specialist at ABC News medical contributor, Dr. Todd Ellerman. Dr. Ellerman, you know, first, we have to be a little bit, or maybe be a Debbie Downer here, depending on your perspective on this. We know several of the fans at the game last night, I think it's 7,500 were vaccinated healthcare workers, but not everyone there was. So what did you think of the setup in the stadium last night? Could this be the way forward for live events, or did it make you nervous?
Good morning, Diane. So first of all, you have to remember I'm a New England kid, so I'm all TB12, right? You can take Tom Brady out of New England, but you can't take New England out of Tom Brady. So the win last night was sort of a quasi-win for me. So I think that, you know, the stadium did everything they could to really decrease risk of transmission. They de-densified it. Only 1/3 of the people that could have full capacity. 1/3 of the stadium had vaccinated healthcare workers in there. They gave KN95 masks to everyone. So, and it's outdoors. So I do think that there's a lot going for last night's event. With that said, the uneven masking, of course, makes me very nervous about transmission.
All right. Well, let's cross our fingers for good news coming out of this, and maybe this could open some doors for more live events going forward if all goes well. But speaking of things going well, the 7-day average number of COVID cases, it's the lowest it's been since November. Same for hospitalizations. On the other hand, we heard there in Eva's piece, the more contagious UK variant could be the main strain here by March. So when you put it all together, what does it all mean? How do we know when we've actually turned a corner?
Well, Diane, I think we've definitely turned a corner. We're seeing that through the numbers. A significant decrease in number of cases per day. Hospitalizations have gone down dramatically, but there's still a lot of COVID, obviously, in the United States, in our communities. So, you know, overall, I think, again, we have to hope for the best that this continues, but prepare for the worst. There are a few more months of winter ahead of us, and with these variants doubling as we're hearing, you know, there is concern that the next couple of months we could see another surge. But I do think over the next, you know, after the next few months, after winter turns into spring, I do think things are going to be very optimistic, especially as more people are getting vaccinated. Remember, each day there are now about 1.3 million people getting vaccinated and only, you know, 100,000+ people that have confirmed cases. So that's good news.
So these lower numbers that we're seeing now, is this the vaccine at work, or will it be a while before we see those impacts?
I do think it's a combination of things. I already told you at our system, we're seeing significantly less staff get infected. I just heard on a call one of the academic centers, 2/3 less staff infected as the peak from just, you know, a couple of months ago. So I think it's a combination. But part of this is the natural ebb and flow of these epidemic curves. Part of it is our infection prevention measures. And I think part of it is the vaccine.
And some epidemiologists are warning that mutations in parts of the world that don't have vaccine access could shift this from a pandemic to an endemic, meaning the virus is around for years or decades. What do you make of that?
Well, first of all, Diane, with global travel, as you know, what happens in other parts of the world will affect us. What happens in the United States will affect other parts of the world. So that's extremely important. I do think that the concern about vaccine equity is so critical. We have to get these vaccines out to the developing parts of the world. That's why vaccines like Johnson & Johnson that don't require ultra freezer type storage and only requires a single dose is so important to get around the world. We have to vaccinate everyone for us to feel protected.
All right, Dr. Todd Ellerman.
One other thing I'll say, though, is last thing is that as far as herd immunity is concerned and as far as eradication, you know, the fact that this is such a transmissible virus, the fact that you can be asymptomatic and still transmit it, and the fact that there's also animal reservoirs makes it that it is possible we won't ultimately be able to eradicate COVID-19. Herd immunity is becoming a little more elusive, but hopefully it turns from something very severe into something more mild, like we see with the flu and common colds, with the prospect of great vaccines.
All right, certainly hope so. Dr. Ellerman, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.